Good afternoon. Welcome to today's NASCSP webinar on individual and family level work. I'm Jovita, your moderator. Today's webinar on Roma Next Generation proposed revisions will be presented by Lauren Cook, CSBG Team Lead of NASCSP, Jackie Orr, a Roma Next Generation Workgroup member and Director of Operations with the New York State Community Action Association, Cashin Yu, Program Associate with the Community Action Partnership, and Barbara Mooney, Director of the Association of Nationally Certified Roma Trainers. Before we begin, a few housekeeping items. All attendees are on mute. If you have questions during the webinar, you can ask questions using the chat option on the webinar toolbar. The toolbar is located on the right-hand side of your screen. There, you'll see a text box where you can type a question for all panelists. Questions will be read aloud and answered during the Q&A portions of the webinar. When typing your question, please identify the topic and/or slide your question relates to, as well as the panelist you'd like to have respond, if applicable. In order to keep to our schedule, if we don't have time for all questions, we will compile your questions into a FAQ following the webinar. The webinar will be recorded and will be posted to the NASCSP website. With that, I'm going to turn it over to Lauren Cook.
Thank you, Jovita, and just wanted to say welcome to everyone who's joining us today, or welcome back to those of you who've been along with us through this webinar series so far. Just to reiterate what we've been communicating in the previous webinars and also on our website, we are in the initial comment period of Roma Next Generation. You can find all of the materials for each of the components for Roma Next Generation on the NASCSP website under the Roma Next Generation tab. There you'll find a component guide that lists links to the surveys, the webinar registration slides and recordings, and all of the actual links to PDFs and Excel spreadsheets for all of the documents that are included in Roma Next Generation. And you'll see in the chat throughout the webinar some quick links so that you can access these if you don't have them in front of you already. Also, as a resource, we have a Roma Next Generation 2016@gmail.com account so that you can contact all of us at NASCSP with questions, whether that's about the content included in Roma Next Generation, or if you're having some trouble with the website or any of the links. Also, if you need help with the surveys that have been posted, please reach out to us. So on our webinar today, we are focusing in on the revisions that have been made to individual and family level work. So we're focusing on the characteristics reports. That includes an all characteristics report and a baseline characteristic report. We're also taking a look at the services list and services report form. And we'll take a look at the National Performance Indicators and NPI report form. So you'll see that the services and NPIs are provided in list and reporting form. We'll go over both versions and help walk you through kind of how you should be reviewing this material. As in our other webinars, we'll also take a look at the survey that has been designed to collect feedback on the pieces included for individual and family level work, and that is Survey 3. It has been posted live to our website. It's also available in a Word document and PDF for your review. So before we jump into all of our reports, the indicators, services, just wanted to take a moment to reflect on kind of why we're here with Roma Next Generation, and also how critical your feedback is throughout this process. So much has been accomplished by this network over the past 50-plus years, and really a lot of adapting and changing to the needs of the people we serve, and just the state of poverty today. And as there has been the development of the org standards and state and federal accountability measures, there's been a lot of great progress. And Roma Next Generation is really kind of that last piece to help us move forward. Very critical in helping us move forward is your feedback on individual and family level work, all of the pieces associated with this webinar today, and the Roma Next Generation framework as a whole. So please visit our website and take a look at the surveys and make sure you are submitting your feedback to us so that we're incorporating it throughout this initial comment period. With that, I'd like to pass this over to Jackie Orr.
Great. Can you hear me, Lauren?
Yes, we can hear you.
Okay, perfect. Well, thank you very much. And for those of you who may have joined a little bit later than Jovita's introduction, I'm Jackie Orr, and I work for the New York State Community Action Association, and I was also a member of the Roma Next Generation work group. And before I start, I did want to wish everybody a happy St. Patrick's Day. All right, so let's dive in. Let's look at what we know about family level work. We know that individuals come to our agencies for services to meet a critical immediate need. Sometimes they're experiencing needs in multiple areas, such as the need for shelter or food. We also know that we need to stabilize them and meet their basic needs before we can help them become more economically secure. As we work with families and individuals to help them achieve outcomes in one or more areas, we know that they become more able to meet their basic needs and therefore they become more stable. Oh, you can go back, Lauren, to the previous one. And then we also know that as families and individuals achieve outcomes and become successful, they move towards economic security. Okay, so if we go to the next slide, Lauren. So let's take a look at what the current individual and family NPI data tells us right now. That it looks like it's both a mix of outcomes and outputs, and that we report on both, and we'll talk more a little bit about that later. We also know that because families are receiving services to achieve outcomes in both goals 1 and 6, that there's been some duplication in reporting over the years. And similar to community level work that we do, and we know that it takes individuals many years to reach an outcome. So the ongoing work that the Community Action Agency is doing gets reported just in the, so to speak, the last report. Okay, Lauren, the next slide. All right, so what do we need now? All right, so we know what we have currently, so what do we need now? We need to better be able to tell the story of the continuum of outcomes that participants need to achieve economic security. Part of being able to do that is having the data that is easily understood and also meaningful when it gets summarized at the national level. We also need to have a common set of measures in order to track the network's performance to demonstrate the impact of services provided to both individuals and families. These measures should capture all of your agency's family and individual activities, not just those funded by CSBG. We also need data to help both agencies and states analyze what is working and to identify steps to improve both services and impact. And as you know, if you've listened to any of the Roma Next Generation webinars so far, that Roma Next Generation has a focus and emphasis on making connections using the data. And when we talk about individuals and families, we mean connecting population with services and with outcomes. So then we can use that data to make service delivery decisions that will help us to improve our impact and our results. Okay, Lauren, the next slide. All right, so we're going to start with who do we serve? All right, so we're going to take a look at demographics and characteristics. So our goal here is to tell who are the individuals we are serving, what do they look like, and be able to eventually connect them to services and outcomes. So we have the biggest change here is that there are going to be 2 reports, and you can see them here on your slide. There's going to be the baseline characteristic report, which is a new report that we'll be going over in a minute in more detail. This will allow us to gather information at intake. And then there's going to be the all characteristics report, which we'll also be going over in a few minutes. And this is somewhat similar to the current Section G report. But there are also new categories that have been added. So as you're looking at the reporting forms and the listings, then you're going to want to take a look at what those new categories are. So what we did is, in order to figure out if there should be new categories and what they should be, the Roma Next Generation work group researched the common reporting systems used in both community action agencies and federal funding sources to see what common information was gathered. There's also been information discussed at other listening sessions that NASCSP has had, and what we wanted to do is we wanted to gather information that's important for you to have at the local level so you can talk about what's happening in your communities and to tell your story. All right, do you want to move on to slide 12? All right, so the baseline report, as I just mentioned, the baseline report is new. This report will collect data from participants when they first engage with a community action agency before they receive any service. So this will help give us a profile of participants at intake. Having the information will allow us to answer the question, what do the participants look like when they first come to us before they receive any services from us? So what is their level of need? So the reason why we're looking at having a baseline report that's new is sort of twofold. So as you know, that the current Section G includes all participants of a community action agency sort of all mixed together. So it can include someone who is brand new to the community action agency who became a participant or a customer within the last couple of days, or it could be somebody who's been with the agency for 1 month, or a customer who's been with the agency for a year. So we also heard that we know that most agencies run the report when it's due, which is typically at the end of the year. So we know that some of the demographic and characteristic information could change over time, and we were just getting the information from the community action agencies when the report is due. So we don't necessarily have information that was gathered at the time of intake. So hopefully this baseline report will give you the information and the tools that you also need for more analysis at your own agency. All right, Lauren, the next slide. All right, so here's a quick look at like a half of the first page of the new proposed baseline characteristic report. It includes comparable information that is included in the all characteristic report, which we'll be talking about in a minute. And as I just mentioned, it's information that will be gathered on participants who had their initial intake in the current year only. The categories have been updated in the report, and we'll be going over them also in a few minutes. And as you look at the report, and it's probably too small for you to read on your screen, but you'll see that there are instructions and directions for the report. And there's a few things I do want to mention that are important, is that we recognize there will be certain situations where you will only be able to collect limited information, that you may not be able to collect all the characteristic categories and characteristics in this report. There will be other situations when it may not be feasible to collect any of the data, sort of maybe when you think about information and referral calls or one-time services such as food box distributions. So the instructions read, as you get to look at them, that if you're unable to collect any of the characteristics, or if the ones you can collect don't enable you to do an unduplicated count, then we ask that you do not complete this baseline characteristic report. Okay, the next slide. Okay, so that was the first report. Now we're looking at the all characteristic report. This report will collect data on all participants at the end of the program year. And this report will provide a snapshot of the reporting within the reporting year. It will also include those who came to your agency for the very first time in the course of that year, and allow us to see who received services during the year and the impact that we made. And then this report will show an unduplicated count of participants. The next slide. Okay, again, here is the snapshot of the all participant report. Again, it's to be used for the participants served during the current program year. And it bears repeating that as with the baseline characteristic report, there'll be certain situations where you will only be able to collect limited information. There'll also be other situations that you won't be collecting any characteristic data, and that it should be in a sure and unduplicated count of the folks. Okay, this slide looks at characteristics, the categories. So let's take a closer look at them. The ones in red, as you can see, have been added or changed to some extent. So what we'll do is we'll just take a look at the ones that have changed. Well, there's in the following slides, there's ones that have changed significantly. So I'll just go through with you now the ones that have changed just somewhat, and then you'll be able to look at those when you have the chance. Education level, that has been added for ages 14 to 24, and it's basically the same categories that are that's included in those ages 25 or over. Also, a graduate or other post-secondary choice has been added to both age groups. As you can see, number 5, there's a disconnected youth age group that indicates working with disconnected youth ages 14 to 24 who are not working or in school. Military status has been added. There's other characteristics, number 8, that include the disabling condition. And if there is a source of health insurance, there's a listing of what different kinds of health, with the source of the health insurance. All right, so let's take a closer look at work status and income. So Lauren, if you could go to the next slide. All right, so this is a new category, characteristics work status for individuals 18 and over, and you can see employed full-time, part-time, migrant seasonal farm worker, unemployed for short-term, 6 months or less, long-term, or unemployed, not in the labor force, and then also retired. And the next category is income, source of household income. That also includes the, so that's just additional information in income. And then if you look at this slide, we have income source, and there's been additions to the income source. The additions have been VA service-connected disability compensation, VA non-service connected disability pension, workers' compensation, child support, alimony, or other spousal support. And then the next slide includes information about the Affordable Care Act subsidy. Okay, so what services do we give them? So when we start thinking about making the connection between the population, the people we serve, and what the services are, and the outcomes, we already took a look at the characteristics that answer the question of who are the people we work with, and then we're being able to identify who they are. So now we're going to start looking at answering the question about what services we provide. So as Lauren mentioned at the beginning, there is a proposed services list. This is a new list in the annual report. This list includes the services we deliver to individuals and families. And as I think I mentioned earlier, that the current NPIs, and there have been people over the years who have said that they are a combination of both outputs and outcomes all mixed together. So what we did is we removed the outputs, which are essentially services, and created this service list. So then this will help us have the ability to eventually connect people, services, and outcomes. And it will also help us get an understanding of what services we are providing that lead to outcomes for our participants. So let's take a look at the proposed services list. Okay, so here are 6 categories of services. You may be familiar and seen these in past webinars. We have employment, education and cognitive development, income and asset building, housing, health and social behavioral development, and support services. So you can see this, there are 6 categories of services, and they're all consistent throughout the reports. And we also have the civic community engagement and community involvement. Okay, so if we go to the next slide, you'll see an example of employment. And this is just an example in the employment domain. So as you can see under skills training, there can be many services offered within skills. So there's vocational training, employment skills, etc. And then at the next list, you can also see that there's even more examples of services for employment. And here you can see under career counseling, we have workshops, coaching sessions, transitional employment, many services offered under job searching, and then there's employment supplies as well. So I think this is where I turn it over to Barbara, and then she's going to talk to you about the reporting forms for the services.
Yes, thank you very much, Jackie, for setting the stage here. What you have in front of you on the screen is the proposed service report form that shows the list of services that Jackie introduced down the left side, and then asks for the unduplicated number of individuals that received those services. There's a choice, individuals or families, that you'll be able to enter. This blue form is the agency level form, and this is what you will enter that will replace in some cases the NPIs that you're familiar with that were really output instead of outcomes. On the next page, you'll see what happens when the state aggregates the data, and this is an automatic roll-up. You won't have to do anything to get for this report, but it's a report that shows what the state will be able to look at. They'll be able to see the number of agencies that are reporting in each of the areas where an agency reported. And as you know, as with all of the information on the current reporting that will carry out in the new report, that if you do not do something, you will not be reporting on it. So you see that that only 13 out of the agencies in this state reported on summer youth work placements, because that's the number of people that did it. So we're not looking at everyone doing everything, but just reporting on what actually happened. And then at the federal level, the report will roll up this data again, aggregate the data, so that we can see that there were 31 states reporting on that first service area, and the total number of unduplicated people that were served. Okay, that's the reporting. I just wanted to step back a second. There was a question about the demographic, the comparison of the baseline demographics with the all demographics, and we will talk about that a little bit more at the end, but I just wanted to mention that we're not asking that you compare the two sets of data, but just that we present two different kinds of data so that we're clear about what the data looks like. So the baseline data is those people that are just coming in during the current year, whereas the all data is the number of total people that you served. And we'll talk more about that as we go forward. I'm going to turn this over to Lauren now to talk about the outcomes.
Thank you, Barbara, and thank you for everyone who is submitting their questions in the chat. That will be helpful for us when we get to the Q&A. We'll try our best to cover as many of your questions as possible, and also cover some of your questions as we continue to work through the webinar. But if we focus in on the national performance indicators for individuals and families, these proposed NPIs have been proposed to really aid us in local and state analysis of the relationship between people, services, and outcomes. So far in the webinar today, we've talked about people and services. Now we're looking at indicators that we are hoping will aid us and also telling our story better and also assistance management programs. Individual and family level national goals. The proposed services and outcomes covered for individual and families align with goals 1 and 3. Goal 1, individuals and families with low incomes are stable and achieve economic security. And goal 3, people with low incomes are engaged and active in building opportunities in communities. The indicators provide a means to measure achievement or movement towards the long-term goal. And we're talking here about goals 1 and 3. The services and NPIs help us document the number of people who receive services and the number who achieve outcomes. So as you're looking through the list of services, the list of NPIs, and then you may transfer your focus to the services report and the NPIs report. The reports are there to help us think through what kind of data the services and indicators will provide for us, and also help us start thinking about what kinds of analysis we can do with this data. So when we're looking at reporting, we're thinking about what change was expected and what change actually happened. We're hoping that will help us answer 2 questions. How does the actual change compare with the expected change, and what % of people served achieve the outcome? So in the first question, we're thinking about how accurate we were in our projections, and in the second, we're thinking about the % of the people we serve who had a success in that particular indicator. Now, the NPIs have been organized to have significant revisions from our prior NPIs, or the NPIs that we're currently reporting on. They are organized by 7 domains, which we'll go over in the next slide. There are 27 indicators in total, plus stability measure options, which we'll also talk more about later in the webinar. You'll see that 2 of the indicators can fall under Goal 3 performance. The 7 domains covered for individual and family NPIs are employment, education and cognitive development, income and asset building, housing, health and social behavioral development, civic engagement and community involvement, and of course stability. And as you're looking through these domains, you'll notice that they do align with the domains for the community NPIs. And when you think about the domains for individuals and families, they kind of reflect parts of someone's life. So before we kind of look at the actual indicators, I just wanted to make sure everyone is considering that we are expecting agencies will only report on indicators as they apply to their work and would not be required to report on all of the NPIs listed. Also, another note on the tracking outcomes for 180 days or 90 days. 180 days is being proposed as a standard that agencies could work toward. The time frame of 90 days included on some of these indicators is included to allow agencies who may have limited capacity to track for 180 days to report on this shorter time frame. So there is the thinking that we would move forward with reporting on 180 days, but this is an area we'd really like to hear feedback. So if we take a look at the employment domain, you'll see that there are indicators that focus on job attainment, looking at obtaining a job up to a living wage or a living wage or higher. We also look at individuals who become self-employed and who maintain their employment for 90 days or 180 days. We also have an indicator on job or career enhancement, where we look at increased income through wage or salary increase or through hours worked. We also take a look at career enhancement through increased benefits. If we take a look at education and cognitive development, in that domain we have indicators that focus in on improved emergent literacy skills for children 0 to 5, also skills for school readiness for children 0 to 5. We focus in on improved positive approaches toward learning and including improved attention skills, and we track these by grade level. We also look at achieving at grade level for early childhood education, 1st grade through 8th grade, and 9th through 12th. There is an indicator on improved home environment, also improved basic education, and then there are indicators on individuals who obtain a high school diploma, also who may obtain a credential or certificate, an associate's degree, or a bachelor's degree. And it's noted in the document that's posted to our website that a lot of these indicators align with Head Start indicators. We did do a review of indicators throughout different programs to try to align the indicators we're proposing to kind of ease some of the reporting. In income and asset building, you'll see we have 2 indicators listed for basic needs. These may change based on the stability indicator options and based on what we hear back from the network. We have an indicator on financial assets, an increase in savings, maybe opening a savings account or IDA account. We look at individuals who use their savings to purchase an asset, purchase a home, improve their credit scores, and increase their net worth. In housing, we take a look at households experiencing homelessness who obtain safe temporary shelter, also households who obtain safe and affordable housing for 90 days or 180 days. We look at households who avoid eviction, avoid foreclosure, improve health and safety of their homes, improved the energy efficiency of their homes, or reduce their energy burden. In the health and social behavioral domain, we take a look at individuals who increase their nutrition skills. We also look at improved health and well-being, either through physical health or mental and behavioral health. We look at improved skills related to the adult role of parents and caregivers, also at independent living situations, and individuals who did not have a recidivating event. This is another domain to take a really close look at. There are quite a few indicators within this domain, so we would love to hear your feedback on these in addition to all of the others. Now, the last 2 domains, Barbara will cover a little bit later in the webinar, but now she will walk us through the NPI report forms.
Thanks, Lauren. And your volume got much better as we went on, so thanks very much for adjusting. So the National Performance Indicator Report Form will look very similar to the way it has in prior years. In that we're asking for the number of people that are served and the number that are expected to achieve the outcome and the number that actually achieved the outcomes. So there may be there may be in your mind something missing there. What's the proposed number to be served? The discussions around the country were with the work group that we didn't need that number for this reporting, that you would of course need that number at the local level. And you'll see that there are a lot of things that we believe are needed at the local level that that aren't reflected in the reports. But what we want to be able to show is 2 kinds of achievement percent, 2 kinds of success. The first being the number of people that achieved the outcome out of the number of people that were actually served. So the actual achieved over the actual served. And in the first case there, it would be 42%. And in the second percent, that's auto-calculated. These percents are both auto-calculated. You just enter the raw data and they're calculated. It shows your accuracy in planning, your ability to target the number of people that are expected to achieve an outcome. This is not a new process. It's something that's been included in the National Performance Indicators for a number of years, but you'll see it now in all of the areas as we projected would happen when the targeting was originally identified. Again, this is the blue form of the report, and you'll see that when we roll this up at the state level, which is the green level of the form, that we're showing the targets, we're showing the actual results, and then we're showing the number of agencies who met their performance target and the percent of those agencies who met their performance target. When you try to aggregate information between different entries, different agencies' entries, the percent of targeting it becomes less meaningful. I mean, it's really not meaningful at all. So the number of agencies that actually meet their own performance target, the target that they set for themselves, is what will roll up at the state level, and then that's also what will roll up at the federal level. So you'll get to see that that federal report form as well, showing the number of agencies that reported and the number of states. Okay, good. So those are the forms, and I'm going to talk a little bit now about the stability measures that Lauren introduced earlier. Are we okay with that? Okay. The first option, there are three options. It's very, very, very important for you to be on the surveys talking about these stability indicators. The work group has suggested that we come up with a way to talk about stability. One of the things that was brought up again and again as we talked to people across the country was that we are in the business of both stability and moving people to economic security. And so how do we actually talk about stability? So there were three options that were presented by the work group. And the first one is that the number and percent of individuals who achieved one or more outcomes as identified by one of the NPIs. So this would be an unduplicated number of people who achieved one or more of the outcomes across all of the domains. That would be one way to say that they became stable, that they met an outcome. The next, this wouldn't be aggregated, but it would actually, because people might meet more than one, so it would require agencies to have an unduplicated count of people who achieved multiple outcomes. And you could think about the number of people that actually did achieve multiple outcomes. That could be something that could be used as in your analysis. So that's the first option. The second option is a sustained impact measure. You'll remember when, or maybe you won't remember, but I'll mention that when Lauren talked about the asset and income domain area, she talked about people being able to meet their basic needs for a 90-day period. This indicator says that the number and percent of individuals who achieved and maintained the ability to meet basic needs for 6 months. And then there's during the initial contact year and in subsequent contact years for those people who are being followed up for 2 to 5 years. So this is the second option is a sustained stability impact measure. We would have to have definitions for what it means to be engaged with, who's being counted, and how would we assess the really ability to meet basic needs. Could they be existing measures, well-validated scales for food, housing, and energy and security. So if this option is selected by the majority of folks, we do have a little work in defining it. The third option is the number and percent of individuals who report improved financial well-being. And this is actually going to be, this is proposed to be measured by a well-vetted, well-documented scale, the CSBG Financial Well-Being Scale, that is where you would ask questions of the participants. And I think we have the questions. Right, so these are the following questions. This statement describes me. I can handle a major unexpected expense. I'm securing my financial future, and so on. You see the kind of statements that are there that are part of the questionnaire that is that would measure this option. So if you like this one, you would talk to this one. Okay. Okay, so those are the three options, and please pay particular attention to this as you're looking at the survey, and give us your ideas and your feedback or your suggestions. When Lauren was talking about the domains, she didn't talk about this one, civic engagement and community involvement. It's because this is related to both the development of individual movement towards economic security, and also to goal 3, which is people with low income are engaged and active in building opportunities in their community. So it plays double duty here. And so we have some examples of who might be counted. So just like other family level indicators, we expect that the agencies will be looking at its own participants for reporting on family level indicators. If they're groups of participants that are from a low-income community that the agency might be working with, but they're not their own participants, they may be recorded in the community-level MPIs, which are also have civic engagement and community involvement suggestions. But at this level, participants are gaining some skills or knowledge or resources that really enable them to be more successful, both in engagement, involvement, and also in moving towards economic security. So these outcomes, like those related to leadership development training and so on, would get counted in this NPI. And the NPI is the number of community action participants, program participants, who increase their skills, knowledge, and so on. And then of the above number and percent who improve their leadership skills and become engaged in leadership roles. And then also the number who improve their social networks, and the number who improve other skills to improve their ability to engage. And this will require some definitions, of course, this other as we go forward. So I'm turning it back over now to Lauren to talk about collecting feedback.
Thanks, Barbara. So we'll take a look at Survey 3. That is the survey on individual and family level work that is posted to our website. Survey 3 will go over the demographics or characteristics reports to get your feedback on the baseline and all characteristics reports, also the individual and family level services list and report, the NPIs, and we have a specific question about the stability indicator option. So in the first part of the survey, we'll ask you to kind of give us feedback on the baseline and all characteristics reports as a whole. The data categories within these reports are the same. So in the second part of the survey, you'll be able to give us specific feedback on those data points, gender, age, et cetera. So we really want your thoughts on the proposal for having a baseline report that would give us a snapshot of participants who come into the agency in that reporting year, and also the second snapshot of all of the participants who are served over the course of that year. And then you would have space to give us specific feedback about how we've broken out those data points, if there are any that we should delete or change or add, so that we can really get the best report possible. In the next part of the survey, we focus in on the services list, where you can give us your rating for the services provided or listed for each domain. And then you'll have another space for open-ended comments on the services listed within each of these domains. We also have a question about data capacity. When we spoke about the services report form, I believe we spoke about needing to collect an unduplicated number of individuals who receive each of those services. We know that individuals will receive possibly multiple services within a domain. So we're asking about being able to collect the unduplicated number of people per individual service that's listed on the report. So we want to get a sense of whether or not you're currently able to collect that information, and we have an open-ended comment box under this question as well, so that you can give us feedback in general. So the next part of the survey focuses in on the indicators. Again, you'll go through each domain, provide a rating, and then have the opportunity to take a deeper dive into the individual indicators within each domain. So as you work through the survey, you can give us your suggestions on revisions that need to be made to the indicators proposed, any general comments about those indicators or indicators you think should be added or taken out. So please spend some time working through the indicators and give us your thoughts of what kinds of changes need to happen. And then in the last part of the survey, we'll focus in on the stability indicator options. So we're asking that you give a rating on each of the options to tell us which will help us show how we're accomplishing Goal 1 either very well or not well at all. And once we get feedback across the network, we're hoping to get a sense of which of these options would be the best to move forward with. There's also space to give us some other ideas of indicators that we could use as a stability indicator option. And now I believe we'll need a little bit of time just to collect our questions that we'll answer as we move into the question and answer period. So I'll move this over to Jovita for a moment, and then we'll get started with the Q&A.
So as the panelists are reviewing your questions, if you have additional questions as you're looking now through your PowerPoint slides, or if you've downloaded some of the materials from the NASCSP website, feel free to enter those questions into the chat box. If we're not able to get to all questions, once again, we will be producing a FAQ, and we're hoping to get those out early next week. We've been doing them after each, or working to compile questions and provide answers after each webinar. So once again, this is your opportunity to speak with those who have been working very intimately on Roma Next Generation and each of its components. So please do ask questions, and we will make sure to get back to you with appropriate answers. and we're working to do that in a timely manner. Additionally, I'd like to emphasize that, once again, your review of all of the components of Roma Next Generation really is critical. What NASCSP is doing is they're providing you with an initial comment period, which ends April 1st. This period will, this happens before then the official Office of Management and Budget clearance process. So we have an opportunity as a network to take a look at what's been done to date, to take a step back, to make any adjustments before we send this out for formal comment through the O&B process. So once again, there are surveys that you can use to provide comments and ask questions. We do have, as Lauren mentioned earlier, an email address dedicated to Roma Next Generation efforts. However, we do encourage you to use the survey first. As you go through the survey, as Lauren demonstrated, you'll have an opportunity to answer some high-level questions, but also provide detailed feedback on specific sections of each component. And I would like to remind you that we do have at least one more webinar coming up. So if you haven't signed up for the rest of the remaining webinars in this Roma Next Generation initial comment period kind of webinar series, we'd encourage you or a staff member from your office to do that. Once again, to hear kind of firsthand someone who's been intimately involved in this process walk you through each component and be able to share that information with your colleagues. So I do see some additional questions are coming in. And I do see one question that I can answer immediately about previous Q&As. We have not posted any of the FAQs as of yet. So once again, we're hoping to begin to post those early next week. And we do have some additional just general questions coming in related to the presentation today. So I'm going to take a moment and see if the team is ready to start responding to questions that have been received.
Yes, we are ready.
All right.
Okay, so I think first it would be good if we go back to kind of the beginning of the webinar on when we were talking about demographic and characteristic information. We'll start with some of those questions now. So we received a question about whether or not the baseline characteristics reporting form would be a standard intake form for all of the participants who are served at an agency. Barbara, I'm wondering if you can speak to that question.
Sure. I think I'm unmuted, yes?
Yes, you are.
Okay. There isn't expected to be a standard intake form, but rather a standard set of data that it will be expected, and each agency will collect their data as they need for all of their programs. I know one of the questions was about ages not being the same for a HUD report. What we tried to do, what the work group tried to do was come up with broader categories of things like age so that other programs could fit within it, so that the data that would go into the CSBG report could be gathered from other kinds of intake forms. So it's more about the standard set of data elements than about an intake form itself. I mean, there will be things like age, for example, that gets reported that would probably be collected by asking for date of birth at the agency level. So there would be different things on the way the agency asks the questions and how it would get then reported.
Thank you, Barbara. Our next question focuses in on the services list. It's a question regarding capturing food and food assistance and resources provided by the agency and how that can be captured on the services list or report. So on the services report, you'll see under the health domain, there are services listed referencing food assistance programs. So take a look at that domain, and you would find it there. We have another question about how to capture services related to financial capability. What domain would you capture those services in? That would be income and asset building. And I know we had spoken a little bit about education and development aligning with the Head Start category. The services and indicators listed under education and development do align with many of the Head Start indicators, but they may not match exactly. Barbara, can you speak a little bit about some of the cross-referencing that was done between different programs to help us create the proposed indicators?
Yes, as I said, this was work done by a work group, and they looked at the kinds of data that were collected from Head Start, weatherization, WIC, HUD, and tried to come up with some commonalities along those various programs. It does not address the problem of bridging multiple systems. That's a huge issue. How do you get this data that you've put into multiple systems out and put into some overarching CSBG program service when that might only be 2% of your agency budget, as one participant mentioned, and you're looking at 40 or 50,000 people. Your system might have to be tweaked in some way to be able to talk or be able to account for those various pieces. But we did look at many of the most commonly referenced funding streams that have been reported over time by the agencies.
Thanks, Barbara. Our next question is about targeting within the NPIs. We received a question asking why it's important to gauge how accurately we planned and what happens when there are events that maybe dramatically disrupt some of the outcomes within that year. Also kind of in that same line, asking about what kind of standard we're using for meeting the target, whether that's plus or minus 20% of the target that was set. And Barbara, I believe that would be a good one for you as well.
So that is the target range, and remember, this isn't something that was just made up by CSBG. This targeting piece, the ability to target, the ability to set and then evaluate performance targets, is part of the DEPRA legislation, and so it's really about federal funding in general, not just about CSBG. So we're really responding to a larger movement in this set of documents. But of course, there are always going to be changes and differences that happen between the projected and the actual, and there will be opportunities for narratives that say this is why this happened. We lost funding. We got funding. There was a plant closure. There was a new business that came to town. All those things will impact on what you project over time. But it's a sense of the ability of an agency, the agency's capacity to know what they should be expecting to happen, and then to be able to say why it did or didn't, so to be able to analyze the data.
Thanks, Barbara. The next question kind of goes over how you would reflect change over time across multiple reporting periods, specifically when we're talking about the 90-day indicator and 180-day indicator. The guidance would be that you would report on the outcomes or services that occurred within that reporting year. So if the outcome was achieved in the next reporting year, you would wait until that reporting period to capture that. Barbara, did you have anything to add to that?
Yeah, I think this is a question about eligibility, and it's done differently in different places. So checking with your state office to make sure that that you're clear about whether you can continue to provide services or not. But the idea is that you're not expected to report on outcomes that you have not that haven't happened. So if someone does not achieve an outcome in the time period where they're eligible, but they do achieve it after they're eligible for service, you may lose that outcome. But that's something that you need to be tracking. When we talk about analysis of data, this would be very useful information for you to have at the local level and to be able to have a conversation between the local agency and the state to say, this is happening, and what might we be able to do, how we might change something in order to meet those needs. But we're not asking that you track something, report on something that hasn't happened. Oh, and then also I see if someone stays in over multiple years, then that's one of the reasons for the beauty, really, of using the term service, how many people were served, rather than how many people enrolled, because someone might enroll in a previous year, but you still provide service in the current year, and they've achieved their outcome in the current year, so you count both the service and the outcome in the year that it happened. So if someone goes over multiple years, then you're able to address that.
Thanks, Barbara. It looks like we have received a couple more questions about the baseline report and who is included in that report. You know, if someone came into your agency and was defined as new for that reporting year, but then they did not come back again for another reporting year, when would you stop labeling them as new or not? Barbara, can you help us with that one?
Yeah, I think the intention of the baseline characteristics report, which is why it's not called new, it's called baseline, was to be able to say, in this year, these were the people who came to us, that we have intake data, that we've gathered data when they first came to us in that year, so that we can get a sense of nationally what the profile is of people who come to community action seeking service. What the Section G report now shows is a variety of different kinds of reporting systems. So some agencies do report that baseline or intake data. But others report, as Jackie said, at the end of the year. They pull the data at the end of the year, and this is the profile of the people after they've gotten service that year or maybe multiple years. And so the intent of the baseline characteristics report was to create a snapshot of people who are there before they get a service. As a way then we were hoping to be able to use the data to compare the baseline and the all programs to see, are there differences in the profile of people. We wouldn't be comparing them as, okay, here are these people and they changed in this way, but rather to say, this is what the people look like who come to us at first. and then this is what people look like after they have received services, or they may have received services again. So we don't expect that you're going to say, oh, someone was here 2 years ago and then we haven't seen them last year, but now they're here this year, so are they new? We're not expecting that you are, we expect that you know that at the local level because you are using that data for management. But in terms of reporting, or just asking for you to give us those people that you did initial intakes on in the current year.
Thank you, Barbara. We've also received a few questions about whether or not there will be an other indicator included on the individual and family NPI report, and whether or not this report will have some of the flexibility that the community NPI report has built into it. As of this,
yeah, in that case, I would say that's a very important thing to include in the survey that you submit. We need to have that kind of information that says we need to have other to be able to have the flexibility. That needs to come from the network as a recommendation. So very important. All the things that you have said in the chat that you think need to be changed or included, or suggestions for change, needs to be reflected in those surveys so that we can present that to OCS.
Okay, great. Thanks, Barbara.
I can also comment on the question about Section G and transportation riders while we're talking about this. For one thing, Section G and the terminology related to the IS report and the sections will all go away with the new annual report format. And so what we're looking at is demographics. And if you have demographics on your riders, then you would include them. If you do not have demographics on your riders, you would include them in the service category. So we're expecting that we're going to be able to tell the story about how many people are riding, and if you don't have an unduplicated count to indicate, this is not an unduplicated count. This is how many riders we have had, so that we show what the scope is of the service, what the magnitude is of the service. I would say that would be the same kind of thing that you would do with some of the food services, where you don't have a long-term outcome, you have a short-term stability outcome perhaps, and you might want to suggest that as an option in your survey and when you talk about stability options. But if you're providing a service, just providing a service, then you're going to be showing that in the services report. That's where you'll show it.
Thanks, Barbara. We received another question about the services report, asking whether or not it is an unduplicated count of individuals by domain or by specific service. It is an unduplicated count by specific service. So one individual may receive multiple services within one domain, but when it comes to reporting on the line-by-line specific service, that would be an unduplicated count. Our next question asks for a kind of an estimate regarding the services domains. If we look at the historic data for the entire network in the past 5 years, what proportion of work reported by the local agencies is reported in each of the proposed domains? Barbara, can you answer that one?
I can answer that sort of in the negative by saying that we haven't captured service data in the past. It has been one of the failings of our system to be able to say the outcomes that we are showing in the NPIs are connected to the services that we give. So we haven't had a service domain area in the past. if you're interested in the way the NPIs have been reported, you can look at the annual NASCSP report that shows the number of outcomes reported in the NPI domains as they currently stand. So that includes a breakout in both Goals 1 and Goal 6 of things in employment and housing and so on. So it's really in a different format because, of course, I think more people get services than achieve outcomes. So the number of people who achieve services will be larger than the number of people who we have already recorded in the NPI data as achieving outcomes. So I don't know if that makes sense or not, but that's what I know.
Okay. Okay, and it looks like the questions are slowing down a little bit. Maybe we can give it a few more seconds. If you have questions that you feel like you really need answered today, go ahead and send that to us. Otherwise, we'll be compiling this into frequently asked questions.
I know there have been a couple of questions about software systems that have come through in this PowerPoint presentation, in this webinar presentation, and in previous ones, and I'm sure we'll hear it again. Express your concerns when you submit survey information, and you know, we know that there was something included in the budget for CSBG that would allow a waiver of the prohibition against this kind of expectation. But we also know that this is going to be a cost that's far beyond the software or hardware systems, but that actually includes the training of staff and data management. So when you think about what goes into that in terms of helping the staff, supporting the staff, supervising the staff that are doing the entry, you'll be, you know, try to figure what that will take in terms of both time and cost. So, you just need to do an evaluation and assessment of your capacity, and then if you have some ideas about that, include them in the survey.
Okay, thank you, Barbara. We have one more webinar left in our webinar series. The next webinar is Tying It All Together on Tuesday, March 22nd, 2 to 3:30 Eastern Time. We hope that all of you will be able to join us again for that final webinar. We'll be reviewing each of the pieces together as a framework, talking more about analysis, and also looking at the CSBG expenditures and agency capacity and resources reporting forms. So we hope to see many of you on that webinar as well. Just to address some of the questions that have come through about the surveys, you will see that surveys are posted multiple times on the component guide. There are 5 surveys in total, and the surveys are listed by each of the components that would be covered in that survey. So Survey 1 covers the theory of change. Survey 2 covers all of the community level components. So that would include the NPIs, the efforts in progress, the community level strategies. Survey 3 covers all of the individual and family level work documents. So that would cover individual and family level NPIs, services, the characteristics reports. And then Survey 4 covers the expenditure report and resources report, and Survey 5, which we are working on finalizing and posting to the website, will cover what we discuss and tying it all together. Survey 5 is a good place to give us your thoughts about data capacity, any general concerns about Roma Next Generation on the whole, and also how you would use this data for analysis. We'll also be updating a survey overview to make that clear on what's covered in each survey so that you make sure you're accessing the correct ones. So with that, we are coming to the end of our webinar. Barbara or Jackie, did you want to add anything before we close out?
No, thanks, Lauren. It's been great having all these questions. We want to see robust responses to the surveys, and so that all of these questions get put on the table for consideration.
No, thanks, Lauren.
Sure. Okay, well, thanks everyone for joining us again today. Happy St. Patrick's Day, and we hope to see you on Tuesday on the webinar.